Hi, this is Brian Wormers and with the University of Sioux Falls, and today we're going to be talking about patients with obstructive sleep apnea. So we're going to talk about some of the diagnostic testings with this, some of the nursing diagnoses, interventions, identify those patients at risk for OSA, and we'll talk about some of the risk factors for this. So with this, some of the pathophysiology. So with this, airways collapse or narrow, and that increases your resistance to airflow with this. Often this occurs during sleep when the muscle tone relaxes, and then of course it narrows and causes increased resistance, and that airway collapses. Periods of apnea may occur with this one, and might progress to the state where there's no tidal volume or air movement at all. This does culminate with some hypoxemia and hypercapnia with this. Risk factors: cigarette smoking, alcohol use, age, 40 to 65, some soft tissue anomalies of the upper airway, menopause, AFib, nocturnal dysrhythmias, type 2 diabetes mellitus, heart failure, pulmonary hypertension, male gender, and obesity. So for the assessment portion of this, what you might see is what they might see and have and disclaim, and you might see would be loud snoring, snorting, having a witnessed apnea event in which they're not breathing, gasping during sleep, recurrent waking during sleep, choking, and generally speaking, they'll feel like they're tired and they're just not getting good rest. So what do we do for diagnostics on this one? Probably the gold standard for this one is polysomnography. With this, we were trying to look and see how they're sleeping, hook them up to wires, watch them sleep for the night, and we're measuring to see are they having apneic spells, are they having obstruction, how many times are they doing this, and going from there. Getting a sleep history with this is also beneficial, like what time do they go to bed, what time do they wake up, how many times in the middle of the night are they waking up, etc., etc. Intervention: CPAP is probably the most common. There are other measures. Weight management, of course, is good for this, as obesity is a risk factor for this. And there are even some surgical management treatments out there right now in which it's going to cause some tightening of that muscle and the airways using electronic stim and different management in that way. Otherwise, treatments to try and open up the airways and to decrease some of the soft tissue has been done. Effectiveness is probably not as good as the other treatment modalities, though. So here's this picture of the CPAP machine with the mask, pressurized hose, and it just provides constant airway pressure in to expand those airways. So like I said, surgical management can be done with tonsillectomy, adenectomy, so removing some of those soft tissues in there and trying to open up that airway. Bariatric surgery is one of those things that we can do too in regards to weight loss and weight management. Long-term complications: this is probably the important thing with OSA, is the fact that in and of itself, it's probably not going to kill them. However, the side effects of this are significant, and over time, it might kill them because it will lead into cardiovascular disease, ischemia, myocardial infarcts, erectile dysfunction, strokes, AFib, heart failure, and sudden cardiac death. So OSA has been implemented or implicated with a multitude of other signs and situations and pathology. So trying to prevent this will hopefully prevent some of those other negative aspects of it. So that concludes this quick presentation on OSA. If you have any complications or comments or concerns, please contact me.